What happens when the doctor gets it wrong? We trust doctors with our lives, and when that trust is broken, the consequences can be catastrophic. But what happens when the AI doctor gets it wrong? And what if it's so fast and integrated that no one notices the mistake until it's too late? We're being sold a vision AI that scans millions of charts, spots hidden diseases, and delivers perfect diagnoses in seconds. AI has shown promise, like spotting tumors in radiology. But here's the catch. What if it's wrong? Unlike a human, an AI can make the same mistake for thousands of patients, instantly with total confidence. We're dazzled by the tech, forgetting to ask basic questions. We're outsourcing life or death decisions to algorithms no one truly understands. A single flawed line of code could cause a silent catastrophe, affecting thousands before anyone notices. That's not progress. That's a tragedy waiting to happen. AI's big selling point in healthcare? Speed. It can analyze an MRI and spit out a diagnosis before you found your insurance card. In theory, this means faster results and quicker treatment. But when AI is wrong, it's a high-speed disaster. Imagine a self-driving car misidentifying a pedestrian, except now it's your diagnosis on the line. An AI can misdiagnose every patient with the same error, at a scale no human could match. Doctors are pressured to trust the AI's confidence and speed, rubber-stamping errors into reality. Human medicine has friction, second opinions, doubt, time to reconsider. AI removes that. We're building a healthcare superhighway with no speed limits, no guardrails, and no one checking if the bridges are finished. The efficiency is seductive, but the risks are enormous. And we're all being told to get in the car and enjoy the ride. Every AI is only as good as its training data. If you feed it biased data, you get biased results. Except now, the garbage out is a life or death diagnosis. Medical data has long focused on white men, so AI becomes an expert on them, and dangerously clueless for everyone else. For example, an AI trained mostly on light skin may miss cancer on dark skin. The result? A system that amplifies existing inequalities, now with the speed and authority of technology. We're rushing to deploy these systems without fixing the data, building a high-tech hospital on a foundation of bias. Until we fix this, AI will only make healthcare's inequalities worse. This isn't speculation, it's already happening. A major U.S. hospital used an algorithm to predict who needed extra care, but it used past spending as a proxy for illness. The result? Black patients were systematically denied care because less had been spent on them historically. The AI learned our biases and turned them into clinical recommendations. IBM's Watson for Oncology was supposed to revolutionize cancer care, but it gave unsafe recommendations because it was trained on limited hypothetical cases. Another AI sepsis tool generated so many false alarms that staff ignored it while missing real cases. These aren't glitches, they're fundamental failures that put patients at risk. The promise of AI is huge, but the reality is often dangerous. When machines get it wrong, the consequences are real, and the warning signs are everywhere. Imagine you go to the ER with sharp pain. Instead of a full workup, your symptoms are plugged into a new AI, diagnosis indigestion, confidence 98.7%. Would you trust it? Most of us wouldn't. We want a human doctor's experience, intuition, and empathy, not just a probability score. Yet healthcare is moving toward this AI-driven future. We're being asked to trust systems that are less nuanced and less accountable than doctors. If a doctor makes a mistake, there are consequences. If an AI does, who's responsible? The hospital? The tech company? No one. We're trading speed for a new kind of risk, invisible, systemic, and impersonal. Before we go further, we need a real conversation about what risks we're willing to accept. Because right now, those decisions are being made for us, far from the ER. Now add climate change to the mix. As the planet warms, disease patterns shift. Mosquitoes bring tropical diseases to new places, and extreme weather causes new health crises. AI, trained on old data, can't keep up with these changes. It's like using a 1950s map in a hurricane. An AI in Canada might miss dengue fever because it's never seen it there before. Extreme events, floods, heat waves, wildfires, create unpredictable health threats AI isn't trained for. The gap between what AI knows and what's really happening grows wider. Our reliance on AI could make us slower to respond to new threats. We're building a system for yesterday's diseases, while tomorrow's are already here. The final problem? The slow removal of human oversight. Algorithms now manage hospital beds, wait lists, and even who gets life-saving resources. These aren't just logistical choices, they're ethical ones. When something goes wrong, who's responsible? The nurse, the administrator, the tech company? This lack of accountability creates a moral vacuum. We're sidelining the human element, doctors, nurses, ethics committees, in favor of cold efficiency. In our quest to optimize, we're stripping out the humanity at the heart of medicine. Put it all together: speed, bias, outdated data, and lack of oversight. Imagine a global AI tool with a subtle flaw, missing a new virus strain, for example. The AI reassures millions they just have a cold, while the real disease spreads unchecked. Doctors trust the tech, public health officials see no spike, and by the time anyone notices, it's too late. With AI, a single error can go global instantly. We're creating a monoculture in healthcare, making us vulnerable to a single, devastating mistake. The potential for crisis is immense, and we're building it ourselves. We're so focused on AI's benefits, we're ignoring the systemic risks. If we keep going, our own technology could cause the next great health catastrophe. The road to hell, it turns out, is paved with good intentions and bad code.